cancer causes more deaths in the world than HIV/AIDS, tuberculosis, and malaria. Among females, cervical cancer is the fourth most common cancer in the world. And in Ghana, cervical cancer is the most common among women. Since it is not too early or too late to discuss it, let's start this month with an in-depth knowledge on cervical cancer. I have with me Dr. Afari. He will throw more light on cervical cancer. This show is proudly sponsored by Moose Condoms, Home Fresh, and B&D Medical Laboratories. Welcome to HealthLink TV show with me, Stella. Let's go for a breather. When we come back, we start our discussion on cervical cancer. Welcome back. Doctor, it's good to see you again.
Good to see you too.
Great. So how is the awareness going?
It's been quite good so far.
Okay.
This particular awareness month has been great.
All right.
We just had a lunch at the National Theatre.
Okay.
And there's a new patron, the second lady of the land. So it's been quite interesting this time around.
That's great.
Yes.
So where is the cervix located in the body?
Okay, so if you look at the female reproductive system or the organ, the cervix we would describe as the lowermost part of the womb.
Okay.
Sometimes we describe it as the mouth of the womb, or some people may actually say that's the neck of the womb.
Okay.
Yeah, so the structure located at the lowest part of the womb is what we call the cervix.
Right.
Yeah.
So doctor, what is cervical cancer?
So cervical cancer is mainly cancer that affects the cervix of a woman. You know, men don't have cervix, so
Okay.
cervical cancer is mainly a cancer involving the cervix of a woman. Yes, so it's a malignancy. That's another term we use to describe cancer. So it's a disease that can spread from the cancer, from the cervix to other parts of the body, if not found early. Yes.
Okay. And what causes this type of cancer?
So cervical cancer now, studies have shown that it's mainly caused by human papillomavirus.
Okay.
Yes, so that is what starts the whole disease in the first place. So if there's no contact with the organism, you're not going to get cervical. Even though these days we found a very small, by majority of small number of the cancer being caused by other organisms, but mainly the human papillomavirus.
I learned they have types of human papillomavirus. So what type, or what's the exact type that causes cervical cancer?
Yeah, so we have a lot of subtypes of or strains of the human papillomavirus, over 100 types of them. But the ones that have this malignant tendency or cause the cervical cancer are the strains the 6, 11, 18, 13, 33. So those are the ones that normally cause the cancer. So the rest are usually you have an infection with the HPV, but it does not result in the cancer.
Okay. Right. And what are some of the early signs of cervical cancer?
So cervical cancer, the early form is mainly asymptomatic. You don't actually see anything or feel anything at all in the early stages.
Okay.
So when you begin to see any signs or symptoms, then it is the advanced stage of the disease. Yes.
Okay. You mentioned stages, meaning there are stages in cervical cancer, right?
Yes, sure.
And what are those stages?
Yes, so we have stage 1,
Okay.
stage 2, stage 3, and stage 4.
Okay.
And this mainly depends on where the cancer is located.
Okay.
So usually if it just confined to the cervix, is stage 1.
Okay.
When it begins to spread to involve the vagina, it becomes stage 2.
Okay.
Then when it moves up to involve the kidneys or the urinary tract, it is stage 3.
Okay.
Then when it goes to the bladder or goes to the rectum,
Okay.
then other areas like the lungs, the spine, and the brain, that one is stage 4.
Oh, okay.
Yes.
Then let's move to the late signs of cervical cancer.
Okay. So the late signs, usually you have bleeding after sex. We call the postcoital bleeding.
Okay.
Yeah, so if anytime a woman you have sex and there is bleeding after that, is one of the signs of cervical cancer. And when you have very bad or fancy vaginal discharge, there's this peculiar scent or odor that the cervical cancer, the advanced stage, presents. So usually when you have that offensive vaginal discharge, you may have cervical cancer. Then other symptoms depending on where it has spread to.
Okay.
So for example, if it's got into the bladder where the urine is stored,
Okay.
you may end up having blood in the urine.
Okay.
Or sometimes if it spreads to where the human excreta is stored,
Okay.
you may actually have human excreta coming to the vagina.
Okay.
Or sometimes when it goes to the kidneys, you may have some pain.
Okay.
Or when it goes to the lungs, you may have other problems associated with that.
Okay.
So depending on where the cancer is located, you
Right.
have those signs and symptoms. Yeah.
Okay. And in what stage will you experience the late signs of cervical cancer?
So usually stage 3 and 4.
4.
Yes,
Okay.
that's when we experience most of those symptoms and signs that we already talked about. Yeah.
Right. I did a research on cervical cancer, and I realized that some oral contraceptives can cause or put someone at risk of getting cervical cancer. How true is that?
Yes, so it's been found on that those who have been on oral contraceptive pills for a longer time, that's about 5 years and above, they have just a small risk. So just a risk. It doesn't mean that once you take the oral contraceptive pill, you're going to get cervical cancer. No, it's just a risk, but it's even a very minute risk. Yes.
Why? Does it contain some of the papillomavirus? Or
Not, but you know, it's a hormonal product, so
okay.
Yeah, it encourages the growth of some of the cancer cells.
How serious can cervical cancer be?
Oh, very serious. You know, it can actually kill.
Okay.
Yes. And most of the cases that we have, they come in advanced stages and they actually die.
Wow.
Currently, the statistics, you have about over 3,000 women getting diagnosed with cervical cancer, and about over 2,000 of them actually die in a year.
Okay.
So it's quite a fatal cancer to have as a woman. Yeah.
Okay, so what is the rate of cervical cancer in the country now, currently?
Now about 21%, but usually when we want to break down, we say that about 4 women actually die of cervical cancer every day.
Okay.
And that one works up to about 1,500 in a year.
Wow.
Yeah, so it's quite a serious,
it's quite serious.
serious condition. Yeah.
All right. And how long can you have cervical cancer without showing any symptoms?
Yeah, you know, it takes a very long time for the virus to cause the cancer. Sometimes it can take about 10 years, 15 years, 20 years, even sometimes up to about 30 years before you begin to show the symptoms.
Okay.
You know, mostly you can get an infection with HPV, that's the human papillomavirus, but the body can clear.
Okay.
Yes, if your immune system is strong, you can actually clear the virus. But some of the people, if you have all the risk factors, you can go on to develop the cervical cancer.
Since you've mentioned risk factors, then tell us more about the risk factors.
Okay. So because it's mainly a sexually transmitted infection, that's the HPV. Okay. Usually if you have multiple sexual partners, yes, you have a high risk. Okay. Then sometimes you may not have multiple sexual partners, but your sexual partner may be having other partners. Okay. Yes, then early age at sex, if you get exposed quite early, your risk of developing the cancer is very, very high. Why? Yes, because, you know, very early for the adolescent or the woman, the cervix is quite fragile. So the organism is able to wreak a lot of havoc, and it takes a while. All the changes that will have to go on for the cancer to develop, you know, you can have it. So when you have sex early and you get exposed, that means your risk of getting the cancer is very high. Yes, even we found out that women who have delivered so many children, yeah, there's also a risk there. because of course it's about sexual contact.
Yeah.
So the more exposure that you get, you also have that risk. Then of course smoking, alcohol, you know, these smoking and alcohol are usually the number one culprit if you come to cancer anywhere in the body. Yeah, so those ones too are there.
Okay.
Yes. Yeah.
I learned that those with a suppressed immune system also are at risk of getting cervical cancer. How does that happen?
Yeah, so it's one of the risk factors. So if you have HIV/AIDS, your immune system is compromised. If you have diabetes, your immune system is compromised. Or even you have any other cancer in the body, or you have any condition that causes depression in the bone marrow, all these conditions can predispose you to having cervical cancer once you are exposed to the virus. Yes.
Early on, you said cervical cancer is malignant, meaning it can spread. So how fast can it spread to other organs?
So it takes a while, like I already talked about. It takes quite a while before it spreads. That's why we have the stages. So it could take about 20 years.
Wow.
It could take about 30 years. That is when the cancer is not developed. But once you have full-blown cancer, it's a matter of months.
30 years without showing any signs?
Yes. It's merely asymptomatic in the early stages. But once you get a full-blown cancer, it's a matter of months. But I can tell you that in terms of the stages, we have what we call the 5-year survival rate. So if you have stage 1, your 5-year survival rate is about 80 to 90%. If you have stage 2, it's about 70%. So the higher you go in terms of the stages, your survival rate comes down. So when you're about stage 4, you have about less than 50% 5-year survival rate. Yes.
And how can cervical cancer be detected?
Yes, so mainly through screening. Yes, through screening, or sometimes when you have maybe an infection, you come to the hospital and we are examining you, we may find out that you have some changes going on around or on your cervix. And we'll go ahead to do further tests. So sometimes we can do the pap smear tests. It can give us an idea whether cervical cancer is developing or not. We can also do the visual inspection with acetic acid, the vinegar. When we smear it on the cervix, if there's cervical cancer or even those pre-cancerous lesions, you can pick it up. Then you can do further investigation. Or sometimes when you have a lesion or a mass on the cervix, we can take a biopsy, take it to the lab, and that one will also tell us whether you have cervical cancer or not.
I want us to talk about how it can be cured. But then, viewers, let's go for a breather. When we come back, we'll continue our discussion on cervical cancer. Welcome back. Enjoy these weekends with Moose condoms. Moose condoms are available in all pharmacy shops. Doctor, can cervical cancer be cured?
Yes, the very early cancer can be cured. You can actually have 100% cure, depending on the stage you have it. Yes.
And what are some of the treatment options?
So the early cancers, you can have what we call cryotherapy. You freeze the cells, the abnormal cells, then they stop growing. Sometimes you can actually do burning. Yes, or you can just take that affected portion off. Then the unaffected part of the cervix is left intact. So you have something like that you can cure. Or we can do surgery. The early stages, you do surgery, you take the womb, you take the cervix. So it's like you take all the cancer with you. So you can have 100% cure. Once it's not spread outside the cervix, once you take the cervix, you take the womb or the uterus, you can have 100% cure.
So how do you treat or manage patients in stage 3 and stage 4?
So those patients, normally we do the chemotherapy and radiotherapy. Yes. So the advanced cases, we give them those treatment options.
And do they survive it?
Like I told you, the survival rates depends on the stage. So the 5-year survival rate is not, if you compare the stage 1 and stage 3, it's not the same.
Okay.
Yeah, so some of them we may give them the chemotherapy, give them radiotherapy, but at the long run, they will still succumb to the disease.
Wow.
Yes, yes.
What are some of the side effects of those treatment options?
Yeah, so for the radiotherapy, for example, it causes a lot of pain. Yes,
How?
pain.
Wow.
Yeah, the radiation.
Okay.
Yes, it's painful.
Okay.
Yeah, so after that, they may have pain.
Okay.
Then sometimes they may have low blood levels.
Well,
after.
before you
Yes.
continue, pain at where?
Pain at the pelvis.
Okay, so I mean
Yes.
they direct the radiation
Exactly.
on this.
Usually
Okay.
before they do it, they will mark the place.
Okay.
Then they will direct the radiation rays there.
Okay.
Then after that, the patient might have some pain.
Okay.
But they have ways of managing those pain.
Okay.
Sometimes too, the radiation can damage other structures, yes, in the pelvis. So you can imagine if it's spread out of the cervix, some of the rays can damage some structures there.
Okay.
Yes, yes.
Can it cause infertility?
It depends.
Okay.
It depends, but if you don't, elsewhere they can save the ovaries.
Okay.
So they will mark a portion.
Okay.
So, but if your ovaries are caught up in the radiation, that means it's gone.
Okay.
Yes. So that is why they do the marking, so that they will direct the rays at where the cancer is, so it doesn't travel out of where the cancer is to damage other structures in the pelvis. Yes.
I heard there is hair loss too.
Yes, usually from the chemotherapy. You
Okay.
can have hair loss, you can have darkening of the skin and the palms.
Okay.
Yes, and some, the chemotherapeutic agents, they are very strong. So sometimes some of the patients end up getting a lot of infections.
Okay.
To attack your immune system also. So they can have throat infections, chest infections after a bout or after a course of the radiotherapy drug. So because of that, usually after a course of it, we allow them to rest, sometimes about 2 weeks or 3 weeks before they go for their next cycle of the drugs, yes.
Okay. Can you feel cervical cancer by inserting your finger into the vagina? Can you feel it at the tip of the cervix?
Yes, so you may have an idea that your cervix is probably looking or feeling rough,
Okay.
or you can actually feel a lump.
Okay.
Yeah, but the fingers are not sensitive enough to tell you. So when you see that, so as a woman, if you feel there's something untoward or wrong with how you are feeling, then you need to go to the hospital. Then they will examine you and determine whether it is cervical cancer that you are developing or not.
All right.
Yes.
And what are some of the complications of cervical cancer?
So cervical cancer, usually if it is early, you may not feel anything. But when it spreads, the advanced stages, like I mentioned, you may have blood in the urine, hematuria, because it's spreading to the bladder.
Okay.
Yes, the cancer can spread to where the fecal matter is stored.
Okay.
So you can have a fistula.
Okay.
A fistula is an abnormal communication between two body organs. So you can have an abnormal connection between the rectum and the vagina. So you may have feces coming inside the vagina.
inside.
Yes. Then the cancer can spread to where the kidneys are.
Wow.
So you may end up getting a kidney disease or even a kidney failure.
Okay.
Yes. Then when it spreads to your liver, you can have a liver problem. Can spread to the lungs.
Okay.
Yes, it can even spread to the brain and the spine.
Okay.
So these are all areas that the cancer can spread to. Now, of course, you can die from it as well.
Okay, that's when it has gotten to the stage 4, right?
Exactly, yes.
All right. Doc, before we wrap up, let's go to Esther as she educates us on the use of IUD and cervical cancer. I'm currently at the family planning unit and I'm here to talk to midwife Esther about the relationship between IUD and cervical cancer. Miss Esther,
Hi,
I hope you're fine.
I'm blessed.
Wow.
Yourself?
Yeah, I'm also good. So, what is IUD?
Okay, IUD is a long-acting reversible contraception. Okay, it is kept in the womb the uterus.
Okay.
And we have two types of IUD. We have the non-hormonal IUD, which is this one. And then we have the hormonal, this is the non-hormonal IUD, or the copper T.
Okay.
And then this is the hormonal IUD.
Okay.
So the non-hormonal IUD is what we do or provide here.
Okay.
Okay, we do not provide the IUS or the hormonal one. The non-hormonal IUD has pads, okay, and it actually has a copper wire around it. Let me just take a sample. So that is how it looks like. So this is how it looks like. It's very flexible.
Okay.
And this is kept in the womb of the woman. And what it does is to prevent the sperms and then the eggs from meeting or from fertilizing. You could see a copper wire around the IUD.
Okay.
That is why it's called copper T. Okay. This copper wire actually emits rays, which causes the cervical mucoid to become thick, to make it difficult for the sperm to travel to meet the egg. And of course, if the sperm is not able to meet the egg, there is no fertilization. This same copper wire makes the lining of the womb thin. It thins it out to prevent the fertilized egg from implanting, okay, or from having a place to stay. So that is it. That is it for copper T, or the non-hormonal IUD.
Okay.
But the hormonal IUD contains a hormone, it's progestogen, and then it has this levonorgestrel hormone. And what it does is it releases these hormones into the uterus. Just a few goes into the bloodstream, okay? And this hormone, its work is actually to prevent the woman from releasing egg or from ovulating. Before a woman gets pregnant, you release egg or you ovulate. But then this hormonal IUD stops or inhibits the woman from releasing eggs in some cases. The hormone also causes the uterus to become very, very, very thinned. All right, so that is what it causes. IUD, I said earlier, is reversible. It means that it can be stopped whenever the woman wants, and the woman can attain fertility. It is not a permanent method. It's for 12 years. We have this copper T is for 12 years, and then this, the Marina, is for 5 years. The hormonal one, which is the Marina, is for 5 years. We actually have types of the hormonal one. We have Skyly, we have Leta, a lot. Right. Okay.
But can it rust? Can the metal rust?
No. It is normal if there is some corrosion with the copper wire. It is normal, but it doesn't really rust. It doesn't get lost.
Wow.
In the system, yes.
And if there is corrosion, won't it affect the health of the woman?
Not at all. Not at all. Normally, it is the ones, this particular part, the lower portion, this particular part. But these ones are always like this. It doesn't change, it doesn't cause anything, it doesn't rust. But this particular ones, because it's been emitted, small, little by little, so there is some bit of corrosion with it, but it doesn't cause anything.
Well, let's go straight to the point. Can it cause cervical cancer?
No, and a big no.
Wow.
IUD does not cause cervical cancer. What it does is prevent a woman from getting pregnant. And I want people to take note. IUD doesn't protect you from STI as well as cervical cancer.
Okay. I get it.
Cervical cancer is caused by a particular virus, which is the human papillomavirus.
Okay.
IUD does not cause cervical cancer.
Okay. So does it mean that in case someone is exposed to the virus through sex and the person is having IUD in place, the person can get cervical cancer? Of
course.
Okay.
That is why I said earlier, IUD doesn't protect you against STIs as well as cervical cancer. It can. If you are being exposed to the virus, that is it.
All right.
So if you know you have multiple sexual partners, then you need to use a condom. Even though IUD is still in place, you still need to use a condom because it's only condom that can protect you from these diseases.
All right. Thank you very much for your time.
Right, welcome.
Right. And I'm very grateful for educating us and clearing the misconception we have about IUD.
You're welcome.
Viewers, let's join Dr. Afari as we continue our discussion on cervical cancer. Welcome back. So now we know that there's no way IUD can cause cervical cancer. Doctor, before you leave, I want to find out how cervical cancer can be prevented.
Okay, so cervical cancer is a highly preventable cancer.
Okay.
We have levels of the prevention. We have the primary prevention. That's mainly the use of vaccines.
Okay.
Yes, and abstinence.
Okay.
Yes, so with the vaccines, currently we have about 2 types of the vaccines in Ghana.
Okay.
We have one that contains just 2 of the subtypes that I talked about. And there's another one that contains 4 of the subtypes. So for young children, both boys and girls, they can be vaccinated against the HPV infection.
Why do you vaccinate the boys so? Because I know the ladies or women get cervical cancer.
Yes, but you know, before you get cervical cancer, you have to have contact with the human papillomavirus.
Okay.
Yes, it's a sexually transmitted infection.
Okay.
So anybody can carry it, whether you are a boy, girl, or a male or a female.
Okay.
And we know that when you vaccinate the children early, they have most benefits from the vaccine.
Okay.
So from the age of 9 to 14, they can be vaccinated against HPV.
Okay.
Yeah, so then from 15 onwards, usually if you are a virgin or you've not had any sexual exposure, you can also be vaccinated.
Okay.
Even those who have had sexual encounters but they are negative when they've done their pap smear test or they have done the HPV DNA test and it's negative, they can also have the vaccine.
Okay.
So that is a primary prevention, and we are actually encouraging people to do the vaccine. Once you are eligible for the vaccine, you take the vaccine and it can protect you at least for so many years, if not for life.
Is it expensive?
Yes, of course. It comes at some expense. Usually on the market is between, I think, 250 cedis to about 500 cedis.
Wow. Is it per shot?
Yes, per shot.
And how many shots do you need?
So for the young age group, they need about 2 shots.
Okay.
But those 15 years and above, they need about 3 shots.
Okay.
Yes, yes.
All right.
Given at certain intervals.
Okay.
Yes. Then the other level of prevention is the secondary prevention. That is when we are highlighting the screening. So when you do the screening and you pick up any pre-malignant lesions, you can treat it. You know, I already said that depending on how early the cancer is, you could even have 100% cure.
Okay.
So the screening methods, the pap smear, the VIA, and even the HPV DNA.
Which one is
the VIA?
VIA.
That is a visual inspection of the cervix with acetic acid, vinegar. Yes.
Okay.
You can also use Logos iodine also to do the inspection.
Okay.
And you can see some features.
Okay.
If it's abnormal, then you can go ahead to do your biopsy. Yes. So the secondary prevention is through the screening. So we're also encouraging women to screen. And the screening, you know, if you go to certain parts of the world, from age 21, they start the screening.
Okay.
And it ends at 64. So any woman between these age groups, you can get the screening done. Then when we pick up any lesions, we can treat it early.
Okay.
Even if you are negative, you need to be doing it regularly. Usually from 3 to 5 years, you have to be having your screening test done.
Okay.
So that at any point, if we pick up any lesion, we can treat it early before it goes to the advanced stage.
All
Yes.
right. So, Doc, what's your final words to viewers concerning cervical cancer?
So cervical cancer is a preventable cancer.
Okay.
So now, all hands on deck. We want to prevent it because when you get it and it's advanced, you may end up dying. Or even the cost of treatment is so high that it's better you prevent than to get it. So now, the call to action for prevention of cervical cancer is now. That is the new tagline that we are using.
Okay.
We want to prevent the occurrence of cervical cancer
Okay.
in Ghana.
Okay.
Yes.
Thank you so much for joining me here.
You're welcome.
I hope to see you again.
Yes.
Viewers, thank you so much for watching HealthLink TV show. To my ladies out there, the call to action is now. Try as much as possible to be screened. Join me same time next week as we discuss another interesting topic. HealthLink, everything on health.